Do you ever find yourself wondering why things aren't quite working the way they used to downstairs? It's a question many men ask as they get a little older, and it can feel like a deeply private, sometimes embarrassing, concern. You might be experiencing changes you don't fully understand. Perhaps noticing that achieving or maintaining an erection isn't as easy as it once was. Maybe you've dismissed it as just getting older. Or maybe you've felt a quiet worry about it. This change can impact intimacy, confidence, and even just your own sense of self. It's a painful reality for many, a silent source of frustration. But what if I told you there might be a hidden factor? A surprisingly common mistake many men make without even realizing it. That could be contributing significantly to these issues. A secret linked to a very natural, personal activity that you might not ever connect with erectile difficulties. In this video, we're going to gently uncover this surprising truth, understand why it's happening, and most importantly, talk about practical ways to turn things around. We'll look at simple adjustments that can make a real difference, restoring function and confidence. Watch to the end for something that will truly surprise you and offer a path forward. Let's start by talking frankly and comfortably about something that's a normal part of many men's lives: masturbation. Now, before anyone feels uncomfortable, remember, this is a safe space for open discussion about men's health. And everything we talk about is about empowering you with knowledge. When we're younger, masturbation often involves a lot of variation and experimentation. We might use different techniques, different levels of pressure, and maybe even lubricants. But as time goes by, especially for men who are in long-term relationships or perhaps not as sexually active with a partner, masturbation can become the primary, or even the only, outlet for sexual release. And here's where the subtle shift often happens. It can become routine. Very routine. Think about it. Over years, maybe decades, a man might settle into one particular method of masturbation, one specific grip, one particular rhythm, one specific type of stimulation. It's efficient, it's reliable, and it gets the job done. Right. And that's fine. In and of itself. The issue isn't the act itself, but the potential consequences of extreme specificity and repetition over a long period. Especially when that method differs significantly from the kind of stimulation received during partnered sex. Here's the silent killer I mentioned: developing a very specific, high-pressure, often rapid masturbation technique that creates a desensitization pattern. What happens is that the nerves and tissues in the penis, particularly the glands, the tip, become accustomed to this very specific, intense, and often quite rough type of stimulation. This desensitization occurs because the body is incredibly adaptable. If you constantly expose the nerve endings to the same high level of pressure and friction, they naturally become less sensitive over time. It's a protective mechanism, in a way. Now, contrast this with the kind of stimulation you typically receive during intercourse. Partnered sex usually involves broader contact, more varied pressure, lubrication that reduces friction compared to a dry grip, and a different range of sensations from the vaginal or anal tissues. The stimulation is generally less localized and less intense in terms of sheer friction and pressure on the glands compared to a tight hand grip. So, what happens over time? The penis becomes conditioned to respond optimally to that one specific, high-pressure masturbation technique. When you then attempt intercourse, the different, often less intense or varied, stimulation isn't enough to trigger a full erectile response, or to maintain it. Your brain and your penis have learned to expect and respond to that specific, intense input. It's like trying to unlock a door with the wrong key. The mechanism is there, but the signal isn't quite right anymore. This phenomenon has a name, sometimes referred to as porn-induced erectile dysfunction. Though it's not always about porn, it's more accurately described as masturbation-induced erectile dysfunction, or, more simply, performance anxiety related to mismatched stimulation. It's not a physical blockage in the arteries or a hormonal problem in the traditional sense. Although those factors can certainly coexist, it's a learned pattern of response, a desensitization of the very nerve endings responsible for sending the pleasure signals to the brain that help maintain an erection. The nerves in the glands and shaft that detect touch and pressure become less sensitive, meaning they require a much stronger stimulus than what is typically provided during partnered sex to get the same level of arousal and signal the brain to maintain blood flow. Imagine your hand getting used to holding a very heavy object. After a while, lighter objects feel almost weightless. Similarly, when your penis gets used to a very high pressure, high friction grip, the softer, warmer, more varied sensations of intercourse might not register as strongly, or they might not be sufficient to keep the erection firm enough for penetration or completion. The good news is that for many men, this is a learned behavior. And learned behaviors can be unlearned. It's not a permanent physical damage in most cases. It's about retraining the nervous system and the brain's response. Understanding this is the crucial first step. Recognizing that your body has simply adapted to a specific type of stimulus helps remove the fear and the feeling that something is permanently broken. It shifts the focus from a medical failure to a behavioral pattern that can be adjusted. The reason this often goes undiscussed is because it's a private matter, and men can feel a lot of shame or embarrassment talking about their masturbation habits. Even with a doctor, they might focus only on the outcome, the difficulty getting or staying hard, without considering the potential link to their self-stimulation techniques. As a surgeon, I've seen many men who undergo extensive tests for vascular or nerve damage, only to find minimal issues, and upon gentle questioning about their personal habits, this pattern emerges. So, how do you know if this might be contributing to your issues? A key sign is often being able to achieve and maintain a firm erection during masturbation, using your usual technique, perhaps even feeling quite stimulated, but struggling to get or keep a similar erection during partnered sexual activity. Or maybe erections upon waking are still relatively strong, indicating the vascular system is likely functioning, but erections on demand for sex are unreliable. This mismatch between solitary function and partnered function is a strong indicator that learned behavior and desensitization might be playing a significant role. Another sign might be that during intercourse, you require very specific types of stimulation. Perhaps a lot of manual stimulation from your partner directly on the glands, similar to your masturbation technique, to maintain firmness. Without that specific input, the erection falters. This reinforces the idea that your penis has become conditioned to a particular type of signal. It's important to differentiate this from other causes of erectile dysfunction, such as cardiovascular disease, diabetes, nerve damage from surgery like prostatectomy, hormonal imbalances like low testosterone, or psychological factors like stress, anxiety, and depression. Often, it's a combination of factors. But this desensitization pattern can be a major, often overlooked, contributor, especially if other physical causes don't fully explain the degree of difficulty. Psychological factors like performance anxiety can also be triggered by this desensitization. A few failed attempts during partnered sex can lead to fear and worry, which further inhibits the ability to get an erection. The worry about whether you'll be able to perform becomes a self-fulfilling prophecy. Now that we've identified this potential issue, the big question is, what can you actually do about it? It requires a conscious effort to change deeply ingrained habits, which can be challenging, but it's certainly achievable for many men. It's about retraining your body's response and increasing the sensitivity of those nerves again. It's not about stopping masturbation altogether, unless you choose to. It's about modifying the technique to be more in line with the sensations of partnered sex. The first step, and perhaps the most crucial, is awareness. Simply understanding that the way you masturbate could be contributing to difficulties with partnered sex is empowering. It shifts the blame away from your body failing you and puts the focus on a habit that can be modified. This understanding alone can reduce some of the performance anxiety because you have a potential explanation and a path forward. The next step involves making changes to your masturbation routine. The goal is to move away from the high pressure, rapid, specific grip that has likely caused the desensitization. Think about replicating the sensations of intercourse more closely. This means using generous amounts of lubricant to reduce friction. Avoid a tight, dry grip. Experiment with different hand positions. Perhaps using a looser grip or focusing on stimulating the shaft more than just the glands initially. Vary the rhythm and speed. Slow down. Explore different types of touch. The idea is to introduce variety and reduce the intensity of the specific stimulus your penis has become overly accustomed to. This retraining takes time and patience. You've spent years, perhaps decades, conditioning your nervous system in one way. It will take more than a few days to change that. Don't get discouraged if you don't see results immediately. Consistency is key. Make a conscious effort each time you masturbate to use a different technique, one that is softer, wetter, and more varied. Another important aspect of this retraining is to incorporate techniques that mimic the sensation of being inside a partner. This could involve using sex toys designed to simulate the feeling of vaginal or anal penetration, or even just using your hand in a way that replicates the gentle pressure and warmth of body tissues rather than a tight, constricting grip. The aim is to make the sensation during masturbation closer to the sensation during intercourse. It's also worth exploring mindful masturbation. Instead of rushing to orgasm, take your time. Focus on the different sensations. Pay attention to how different types of touch feel. This not only helps in retraining, but can also increase overall sexual awareness and pleasure. Mindfulness can help you connect with your body's responses in a new way. While you're working on changing your masturbation technique, it can also be helpful to take a break from your old method altogether. Some men find that taking a complete break from masturbation for a period sometimes called a reset can help to resensitize the nerve endings. The length of the break varies from person to person, but often a couple of weeks to a month can make a noticeable difference. During this time, your nervous system has a chance to forget the old, specific stimulus pattern and can become more responsive to a wider range of sensations again. This isn't necessary for everyone, and for some men, it might create anxiety if a complete break feels too daunting. Simply focusing on changing the technique as described above is a great starting point. The key is disrupting the old, problematic pattern. Beyond just the physical technique, consider the context of your masturbation. Are you always using highly visual, stimulating content like pornography? While pornography itself isn't inherently bad, relying solely on extreme or fantasy-based content can also contribute to a mismatch in expectations and responses during partnered sex. The visual and auditory cues in pornography are often very intense and unrealistic compared to real-life sexual encounters. If your brain becomes conditioned to require that level of intense visual stimulation alongside your specific masturbation technique, it can make it harder to become aroused and maintain an erection with a partner where the visual and auditory inputs are different and often less extreme. Varying the type of content you use, or even practicing masturbating without visual aid sometimes, can help to make your arousal response less dependent on specific, artificial stimuli. It encourages your body and mind to respond to touch and physical sensation more directly, which is crucial for partnered sex. It's about broadening your sexual palette, so to speak, so your body isn't just tuned to one very narrow frequency of arousal. Let's think about this in another way. Imagine you only ever ate incredibly spicy food. Over time, your taste buds would become less sensitive to milder flavors. When you try a dish that's only moderately spiced, it might taste bland to you. It's not that the milder food has no flavor. It's that your taste buds have been desensitized to anything less intense than what they're used to. Similarly, if your penis is only ever exposed to a very high level of pressure and friction, the more nuanced, gentle, and varied sensations of intercourse might not register as strongly. Retraining is about recalibrating those sensitivity levels. It's about teaching your nervous system that a wider range of sensations can be pleasurable and can lead to arousal and erection. This process requires patience and consistency. It's not a quick fix, but the results can be incredibly rewarding. Many men who have struggled with this issue and successfully changed their habits report significant improvements in their ability to get and maintain erections during partnered sex. Now, I want to be clear. This isn't about blaming anyone. This specific masturbation technique often develops naturally and unintentionally over time. It's born out of convenience, efficiency, and personal preference. Most men who do this have no idea it could be contributing to difficulties later in life. The purpose of highlighting this isn't to make anyone feel guilty, but to provide a practical, actionable explanation and a potential solution for a problem that causes significant distress. It's about empowering you with information to take control of your sexual health. It's also important to remember that while this specific issue is common, erectile dysfunction can have multiple causes. If you are experiencing difficulties, it's always a good idea to talk to a doctor to rule out other potential medical conditions like heart disease, diabetes, low testosterone, or neurological issues, all of which can impact erectile function and often become more prevalent as we age. Sometimes, addressing one or more of these underlying conditions in parallel with behavioral changes is necessary for the best outcome. However, for many men where other causes don't fully explain the problem, or where there is a clear discrepancy between solitary and partnered performance, addressing the masturbation technique can be a game changer. It's a surprisingly simple change in concept, though perhaps requiring discipline and practice, that can restore natural function and confidence. So, to summarize this critical point, the mistake is developing a very specific, high-pressure, often rapid masturbation technique that leads to desensitization of the penile nerves, making it harder to respond to the different, often less intense, stimulation of partnered sex. The solution involves consciously changing your masturbation habits to be softer, wetter, slower, more varied, and more reflective of the sensations experienced during intercourse. This requires patience, consistency, and a willingness to experiment with different techniques. Taking a temporary break can also be helpful for some. Next, we'll delve even deeper into practical steps you can take, including specific techniques to try and how to measure your progress, as well as discussing the psychological side of things and how to manage any anxiety that might arise during this process. This isn't just about a physical habit. It's also about retraining your mind and building confidence. Continuing our discussion on retraining, let's get more specific about techniques you can use during masturbation to help resensitize and recalibrate your penis. The goal is to move away from that tight, dry, rapid grip that has become the dominant stimulus. First and foremost, lubricant is your best friend. Use a generous amount. This immediately reduces the intense friction and pressure on the glands and shaft. Experiment with different types of lubricants to see what feels best. Water-based are generally safe with most materials, but silicone-based can feel silkier and last longer. Applying the lubricant not just to your hand, but also directly to the entire shaft and head of the penis is important. Next, focus on a looser grip. Imagine your hand is a warm, moist sheath, not a vice. The pressure should be gentle to moderate, not constricting blood flow or pressing intensely on the nerve endings. Explore different hand positions. Sometimes simply holding the base of the penis and stimulating the shaft with the other hand, or using both hands with lighter pressure, can introduce variety and reduce the intense localized stimulation of a very tight grip just behind the head. Vary the speed and rhythm. If you've been used to a fast, intense rhythm aimed solely at reaching orgasm quickly, consciously slow down. Explore different speeds, slow, steady strokes, interspersed with pauses. Pay attention to the different sensations at different speeds. This teaches your nervous system to respond to a wider range of tactile input. Experiment with stimulating different areas of the penis. Don't just focus on the shaft moving up and down. Gently touch and massage the glands with a soft touch. Explore the frenulum, the band of tissue on the underside of the glands, with lighter strokes. Stimulate the base of the penis. Incorporate touching the perineum, the area between the scrotum and the anus, which is also rich in nerve endings. The more varied the stimulation, the better you are at retraining your penis to respond to different types of touch, which is crucial for partnered sex. Think about incorporating techniques that mimic the feeling of body tissues. Using your hand in a way that replicates warmth and gentle pressure can be helpful. Some men find using their inner thigh, or even a soft pillow between their legs, and simulating thrusting movements against it, can help mimic the feeling of penetration without the high-pressure grip. Sex toys specifically designed to simulate the feeling of penetration can also be very effective tools in this retraining process. These are often made of soft, body-safe materials and provide a different kind of tactile sensation than a bare hand. As you practice these new techniques, pay attention to what feels pleasurable. It might feel different initially, perhaps less intense than you're used to, and that's okay. The goal isn't necessarily to have the same kind of orgasm you had with the old technique right away. The goal is to make the process itself more varied and less reliant on that single, desensitizing stimulus. Over time, as your sensitivity returns, you will find pleasure in these different techniques, and they will become more effective in eliciting arousal. Another strategy to consider is delaying orgasm instead of rushing to climax. Practice building arousal and then backing off just before the point of inevitability. Let the sensation subside a little, and then start stimulating again. This helps build your control and teaches your body to sustain arousal for longer periods without needing constant, intense stimulation. This can be particularly helpful during partnered sex, where the rhythm and intensity might not be constant. Consistency is key with these techniques. Try to incorporate these variations every time you masturbate. It's like learning a new skill. It takes practice and repetition to overwrite the old habits. Don't get discouraged if you slip back into your old techniques sometimes. Just gently guide yourself back to the new approach. It's also important to manage expectations and reduce pressure on yourself. This is a process of exploration and retraining, not a pass or fail test. If you are working on this with a partner, open communication is vital. Explain what you are doing and why. Your partner can be incredibly supportive and understanding. They can also help you practice by incorporating different types of touch and stimulation during foreplay and intercourse. This shared journey can deepen intimacy and reduce performance anxiety. Speaking of anxiety, it's a significant factor in many cases of erectile difficulty, including those related to desensitization. A few instances of struggling to get or keep an erection can lead to a vicious cycle of worry. You start anticipating failure, which creates anxiety, which in turn inhibits erection. It's a self-fulfilling prophecy. Addressing this anxiety is crucial. Understanding that the difficulty is likely a learned behavioral pattern and not a fundamental failure of your body can significantly reduce the psychological pressure. Remind yourself that you are actively working on improving things. Focus on the process of retraining and rediscovering pleasure rather than solely on the outcome of achieving a rigid erection every time. Mindfulness techniques, relaxation exercises, or even talking to a therapist or counselor specializing in sexual health can be incredibly beneficial for managing performance anxiety. They can help you develop coping strategies and reframe negative thought patterns. Don't forget about the broader aspects of your health, which also impact sexual function. Maintaining good cardiovascular health through diet and exercise is essential, as erections rely on healthy blood flow. Managing stress, getting enough sleep, and limiting alcohol and tobacco use are also vital for overall well-being and sexual health. While these might not directly address the desensitization issue, they create a healthier foundation for your body to respond to the retraining efforts. Think of this retraining process as similar to physical therapy after an injury. You have to work at it consistently to regain function. It requires patience, dedication, and a willingness to explore and adapt. The rewards, however, can be significant, not just in terms of physical function, but also in terms of confidence, intimacy, and overall sexual satisfaction. Many men find that as they become more sensitive to different types of touch through this retraining, their sexual experiences, both solitary and with a partner, become richer and more pleasurable. It's not just about getting a hard erection. It's about rediscovering a wider spectrum of sexual sensation and response. So, to recap the practical steps for retraining: use generous lubricant, maintain a looser grip, vary speed and rhythm, explore different areas of the penis, consider simulating penetration with toys or other methods, practice delaying orgasm, consider a temporary break if needed, vary your media consumption, and address underlying anxiety through mindfulness or therapy. These steps are designed to disrupt the old pattern, increase sensitivity, and broaden your body's ability to respond to varied stimulation. Remember, you're not alone in this. This is a common issue, and it's addressable by understanding the cause and taking deliberate steps to change your habits. You can significantly improve your ability to get and maintain erections during partnered sex and enjoy a more fulfilling sex life. The next part will bring everything together and focus on the encouraging path forward. So, we've talked about a surprising mistake many men make: developing a very specific high-pressure masturbation technique that can lead to desensitization and make it harder to get or keep an erection during partnered sex. We've explored why this happens and gone through practical steps to retrain your nervous system by changing your masturbation habits to be softer, wetter, slower, and more varied. It's vital to remember that change takes time. You've likely had this specific habit for many years, so reversing the conditioning isn't going to happen overnight. Be patient with yourself. Celebrate small victories. Maybe the first time you try a new technique, it feels awkward or doesn't lead to the result you expect. That's perfectly normal. The key is consistency and persistence. Keep trying the new methods. Keep exploring what feels good with lighter touch and less friction. Don't fall into the trap of thinking that if you don't see immediate results, it's not working. The nerves need time to resensitize, and your brain needs time to relearn how to respond to different levels of stimulation. It's like exercising a muscle that's been dormant. It takes consistent effort to build strength. Similarly, it takes consistent effort to rebuild sensitivity and response. Think about setting realistic goals, instead of focusing solely on achieving a perfect erection during intercourse immediately. Perhaps focus on the process of retraining during your solitary moments. Focus on making your masturbation sessions about exploration and varied sensation, rather than just reaching orgasm in the fastest, most intense way. As you get more comfortable and sensitive to these new techniques, you will likely notice improvements in your ability to respond to your partner's touch. Incorporating foreplay is also incredibly important, both during this retraining period and generally. Extended periods of varied touch, kissing, manual stimulation by your partner, and oral sex can help build arousal gradually and make your penis more responsive before attempting penetration. It also shifts the focus away from penetration as the sole measure of sexual success and emphasizes pleasure and intimacy in a broader sense. If you have a partner, involving them in this process can be immensely helpful. Openly discussing what you're learning and the changes you're trying to make can foster understanding and reduce pressure. Your partner can be a source of support and can help you practice. Perhaps you can explore different types of touch together, or they can incorporate the techniques you're practicing into your shared sexual activities. This collaboration can strengthen your bond and make the journey less isolating. Remember, this is about improving your sexual health and overall well-being. Erectile function is often a barometer for general health, particularly cardiovascular health. So, while you're addressing this specific issue, continue to prioritize healthy lifestyle choices, a balanced diet, regular exercise, managing stress, getting enough sleep, and avoiding smoking. These habits benefit your entire body, including the systems responsible for erectile function. For some men, despite making these behavioral changes, difficulties may persist. This is why it's so important to consult with a healthcare professional, preferably one who specializes in men's health or urology. They can assess for other underlying medical conditions that might be contributing and discuss other treatment options if needed. These might include medications like PDE5 inhibitors, like sildenafil or tadalafil, vacuum erection devices, or other therapies. Addressing the desensitization issue alongside other potential medical causes often yields the best results. The surprising truth we uncovered is that a seemingly harmless, private habit can, over time, subtly diminish your body's natural responsiveness to the kind of stimulation you receive during partnered sex. But the encouraging part is that this is often a learned behavior, and you have the power to unlearn it. By making conscious changes to your masturbation techniques, you can retrain your nervous system, increase sensitivity, and improve your ability to achieve and maintain erections during intercourse. This isn't about judgment. It's about understanding your body and how it works. It's about taking proactive steps to address a common issue that causes distress for many men. You are not alone in this. And you are not broken. You have simply adapted to a very specific stimulus. And now it's time to teach your body to respond to a broader range of pleasurable sensations again. Remember, small changes can truly make a big difference in your sexual health and your overall happiness and confidence. Taking the steps we've discussed, being aware, changing your techniques, being patient, managing anxiety, and considering your overall health are all powerful ways to take control. If anything we've discussed today resonated with you, or if you have questions or experiences you'd like to share, please feel free to leave a comment below. Sharing your journey might help someone else who is going through something similar. If you found this information helpful, please give the video a like. It helps us reach more men who might benefit from this important conversation. And don't forget to subscribe to our channel for more videos on men's health and well-being. Designed to empower you with practical, clear information as you navigate life's changes. Thank you for watching and for being open to this important discussion. Taking care of your sexual health is an essential part of living a full and confident life at any age. You have the power to make positive changes. Live your best life at every age.